talar swing.
Talar swing.
Yeah. So what I can do is my index finger on the medial side of the ankle is going to palpate the medial talar tubercle. Yeah. The index finger on the other one doesn't matter so much. That's going to go around the back of the fibula. You can, with a lot of effort and with no small discomfort to the patient, palpate the posterior aspect of the talus, but it's not worth it. So it just sits around there. Thumb goes on the neck of the talus, don't care which one, the other thumb goes over it, and your other fingers are underneath the sole of the foot. And then what I'm going to do is I'm going to flex and extend the knee. But as I do it, I keep the foot, the sole of the foot, parallel with the ground. This is what's important. And this will produce plantar flexion and dorsiflexion of the ankle. Yeah? If I'm not careful with this, all I get is flexion extension of the knee. This is really important, you maintain that. So what I'm feeling for is as I do that, first off I can see what the range is, see whether it seems like the right amount. I can feel the infield for dorsiflexion, and I can palpate that medial talar tubercle. And what I'm feeling for is that pressure to increase. Yeah? So at one time I'm doing three things. I'm looking at the physiological movement, four things actually, the end field of the physiological movement and the range of it. I'm also looking at the glide, and I'm feeling for the conjunct rotation. Yeah? And that doesn't feel wonderful. Look at this one. And this one actually is moving a good deal better. This one isn't dorsiflexing enough. Plantar flexion okay, but this one is really going quite a way in. Is that okay? When you was testing dorsiflexion, who was testing it?
Cheryl.
Okay.
And Dave.
Was there a limitation of dorsiflexion on that ankle?
Yeah.
Yeah. And right now I can tell you it's not gliding. And in fact, if you think about it, what muscle can stop the ankle joint moving? Pretty much anything that goes over the top of it. Yeah? What can stop it gliding? Pretty much nothing. So if the glide is blocked, then you know that there has to be a joint problem. And believe me, if you're doing, how much calf stretching are you doing in your patients now? The only time you should be stretching calves is after surgery and after being in a cast. These muscles, if they tighten up, it's because they've got hypertonicity. Right? Should be stretching these.
After mobilization.
Anytime.
Or after you.
Anytime.
I mean, it's a good time to stretch it.
Nope.
Ever.
Unless they're actually, unless you've got adhesions. Well, in the muscle, actually, if we're talking about stretching the gastrocs, unless you've torn that, so you've got scarring in there, you shouldn't be stretching it. How's that go down?
How about in relation to tone? When you're saying
They deal with the tone. Yeah.
I mean, if you're stretching, you know, a lot of times I'll stretch for tone,
But
muscle
there are
energy,
better ways of
just
doing it,
decrease
and
the
it's very
tone.
temporary. Find the cause of the increased tone and deal with that. But stretching for tone is actually traumatic and not a very efficient way of doing it. Yeah. All right, jump down. Let me do something else. Give me a new body.